Hello friends, welcome to Fast Coder 21 free medical coding YouTube channel. As all of us know, in ICD-10 CM we have two types of Z codes. So one is for status code, next one is for history code. But most of the coders don't know about the differences between status code versus history code. So in this session, we are going to learn what is the main difference and how do we identify when do we code status code and when do we code history code. If you are visiting for the first time, please click on subscribe button to receive future updates. If you want to clear your doubt regarding status code versus history code, please watch this video until the end. So first we will learn about status code. So what is status code? So status code indicate that a patient is either a carrier or a disease or has the sequela or residual of past disease or condition. So basically status code is the code so where patient will have the sequela or residual of past disease or condition. So here in status code, patient is not going to have complete get rid of his or condition. So for example, we will take coronary artery stenting. So we will use jet 95.5. Here, whenever patient comes to the hospital, always we need to give jet 95.5. Where patient does not get rid of his coronary artery disease, because of that reason physician has implanted coronary artery stent. So for example, patient has visited the physician for hypertension treatment. So that time, so we need to give patients jet 95.5 coronary artery stent code as hypertension treatment is related to coronary artery stent presence. So here we can give Z code as a status code in order to know the physician that patient has previous coronary artery stenting. So based on that, physician will provide the appropriate treatment to the patient. Just one thing you need to remember here that in status code or while we are using status code, patient will not get rid of the total condition or past condition. So here patient needs to have residual of that condition which he has undergone the past treatment. For example, if you take knee replacement, as long as the patient's visit to the hospital, we need to apply replacement status. So it will affect the patient's current treatment. So we can't use status code along with the diagnosis code from the body system chapters. So for example, we have one code for complication of heart transplant. Here we will code T86.2 series code. Here we can't apply status code like Z94.1 heart transplant status as complication of heart transplanted is already mentioned in the T86.2. So here we no need to give Z94.1 as heart transplant status included in the heart transplant complication code which is T86.2. So here T86.2 denotes that patient has heart transplant and also patient has complications of heart transplant. So here we no need to code Z94.1. When we will code heart transplant status, if the patient is coming for any related condition like any chest pain, hypertension or any type of circulatory system disease, we can code heart transplant status, so which is related to the circulatory system complication. So what are the common status codes? We have Z14 genetic carrier. So we have Z15 which we will use it for genetic susceptibility to disease, and we have Z16 resistance to antimicrobial drugs, Z17 estrogen receptor status, Z18 retain foreign body fragments, and Z19 hormone sensitivity malignancy status. And also we have Z21 asymptomatic HIV infection status. So here also Z22 carrier of infectious disease, Z28 3 undetermination status, under immunization status, Z33-1 pregnant state incidental, Z66 do not resuscitate, Z67 blood type, Z68 body mass index, which is the most common we will use while coding along with the obesity code. And also we have Z74.01 bed confinement status and Z76.82 awaiting organ transplant status, and also we have Z78 other specified health status, and most common we will use for medications Z79 series, so which is long term drug therapy. So and also we have Z88 allergy status to drugs and Z89 acquired absence of limb, Z90 acquired absence of organ, Z91.0 allergy status, Z92.82 status for administration of TPA, Z93 artificial opening status like gastrostomy, colostomy status, Z94 transplanted organ and tissue status. So for example, heart transplant status, we will code Z94 series, and Z95 series is for presence of cardiac and vascular implants and grafts like coronary artery stents. Z96 is for presence of other functional implants. Z97 is for presence of other devices, Z98 other post-procedural status, and Z99 dependence on enabling missions and devices. So generally we will use Z99 series is for CPAP. So if you check in the status index, so we have multiple codes here. So all are Z codes like anastomosis. So basically here physician has performed the anastomosis, but patient did not get rid of this condition. So this is a related after the past surgery. So as we have discussed angioplasty, coronary artery with implant status Z95.5. So as long as the patient has the condition, patient needs to have this implant. So this will become a status code. And we have aorto coronary bypass, arthro disease, artificial opening, bariatric surgery status, and breast implant status. So all the like colectomy status. So these are the common status codes which we will encounter during our regular coding process. So now we will learn about history code. So basically, as soon as you see history code means patient has the condition that has or patient has undergone the treatment. Currently, patient does not have any condition. For example, patient has breast cancer previously. So, patient had undergone breast cancer treatment by mastectomy. So, currently, patient does not have any implants or any type of complications. So now we will code history code as here patient currently does not have any type of breast cancer as patient had undergone breast cancer treatment by mastectomy. So here basically we have two types of Z codes. One is personal and second one is family. So personal history codes will explain to us patient's previous condition, and also it denotes patient had previous condition and he or she underwent the treatment in order to get rid of that condition, and currently patient does not have that condition. So as there is a potential for recurrence and therefore may require continued monitoring. So most of the time we will code Z08 for encounter following complete cancer treatment. So for example, patient had prostate cancer and he had undergone the treatment. So for the next visit, as there is a chance of reoccurrence, patient will come to the physician in order to check whether this cancer reoccurrence or not. So here we need to code Z08 as the completed treatment for the malignancy, and also we need to code history code, so which is Z8546 for prostate cancer. So during the visit, if the physician identifies any type of cancer recurrence, we need to code regular code like C61. So for example, if the patient does not find any abnormality, we need to code Z08 first followed by Z85.46. So Z85.46 denotes that patient has a history of cancer, prostate cancer, and currently patient does not have any type of prostate cancer. So next one is family history. So whenever mostly we will use family history in colonoscopy coding. So basically family history is related if the patient comes in for colonoscopy screenings. So what happens if the patient's family is having any type of colon surgery previously, there is a chance that patient may have or will have colon cancer. So that time we need to give family history indicate that patient's family is already having the colon cancer. Generally, we will use personal history codes along with follow-up codes. So family history codes we will use along with screening codes like colonoscopy coding. So if you see here in index, we have history, family history first. So next we will find personal history. So like this, we have two types of history, family and personal. So first one is family, this one is personal. So we need to check here. So basically you need to understand that status code where when we will use is if the patient has any sequelae or residual of past disease or condition. So history code, there is no chance or recurrence of previous or past condition. Thank you friends. Thanks for visiting Fastcoder 21. Please watch, learn, comment, share and like.